I'm Dr. Nina Wilson, and this video is for women who've been prescribed AndroFeme testosterone therapy. I'm going to show you the product and how to use it. So it comes in a box like this. You should always check the expiry date to make sure it's in date. And when you open it up, you'll find a tube of cream and a syringe to help measure it out. The tube will usually last around 90 days or 3 months, and that's if you're using it at the typical dose of 0.5 millilitres a day. Now, your dose may be adjusted and therefore just follow your doctor's instructions. When you open the tube for the first time, there's a little silver cap to remove, just sealing the cream so you know it's fresh. And then take your syringe, pop it into the neck of the tube, and hold it upright like this, and begin to withdraw the plunger. Because the cream's quite thick, it doesn't flow out as easily as Calpol or something like that. You need to pull a little bit more, and so you can end up with quite a bit of air in the tube as you do that. That doesn't matter, just gently push the plunger back into the syringe, and the air will flow out, leaving the cream behind. And if you do that gradually, you can push the plunger up to the 0.5 milliliter mark like that, and then you've got the amount that you need. So let's see, how big is this? People used to say, oh, it's a pea-sized amount, but actually it's a bit more than that. Let's have a look. Okay, so that's all out now. You can see it's definitely bigger than a pea. It's bigger than a baked bean. It's probably the size of a soybean or a kidney bean. And you can also see that there's a bit left in the syringe. That is normal. And it's one of the reasons why people get a bit annoyed with using it, because it's wasting this cream each time. But once you get a feel for the size of the blob that you need, a lot of women just use that each day, judging it by eye. So take that blob, rub it on the side of your thigh, on the outer thigh. If you rub it on the inside of the thigh, it can increase the absorption. So rub it on the outer thigh and then let it dry, and avoid skin contact with other people or pets for at least an hour to avoid transfer. All you need to do then is put the cap back on your testosterone and rinse out your syringe, pop it back in the fridge. If you're having blood test monitoring, and it is recommended that you have the levels checked every 6 months, at least to begin with, until you find where your level is stable, it's very important to remember that you should have the test done ideally between 18 and 24 hours after the last application of testosterone. So if you put your testosterone on in the morning, you should go for the blood test first thing in the morning, and wait until after the blood is drawn before you put your testosterone on that day. If you put your testosterone on at night, it can make it a little bit more difficult, because it tends to be harder to get a blood test later in the day. But do try to make sure that you're aiming for an 18 to 24 hour gap after the last application, because it does impact the interpretation of results. So I hope that's helpful, and off you go.